Malik. Today we'll talk about an important topic, heart failure, congestive cardiac failure or congestive heart failure. It is called heart failure. We can call it cardiac failure or congestive heart failure or congestive cardiac failure. There are multiple names for it. Today morning at 4 o'clock, we got a female patient around the age of 50-52. She came with acute breathlessness. She was unable to breathe. The lungs are full of fluid, water. You can say our own body water. That means you are drowning in your own water. The body contains 70% of water. As you all know, the body is containing 70% of water, and the rest of the 30% is only everything. 70% is water. So you are getting drowned in your own secretions. You are getting drowned in your own water or secretions. So she's acutely breathless. She's unable to breathe. So immediately we have put the patient on ventilator. She's fine now. Okay. But not every patient comes with this much problem. Some patients come with mild breathlessness. Some people come like this severe breathlessness. They are unable to breathe at all. The saturation is coming out. There is froth from the mouth, etc., etc. The lungs are full of fluid. So immediately we put the patient on ventilator and start the treatment. Okay. But what is this heart failure, or what is this congestive cardiac failure or congestive heart failure? So what is this cardiac failure? Usually the heart fails to pump. The heart fails to pump. That is the reason. The heart fails to pump. There are two types, systolic and diastolic. One is the heart is unable to pump. Ultimate result is the heart is unable to pump properly. So the body is not getting sufficient blood or whatever it is. That's why that is the response of the body. The heart is not pumping properly. That is the reason. In heart failure, the pumping of the heart comes down to minimal stage. Okay. See why it happens, in what condition it happens. Number one is anemia. Anemia means there is very low blood, that is 4 grams or 5 grams. Usually at least up to 10 grams is needed. 10 grams hemoglobin is good. Not good, it is okay. Above 10 grams is good. But what we find in these patients is 4 grams, 5 grams, etc. Even below. 4 grams or even below also sometimes. The patient is very pale, and as a response, the heart is unable to pump. The heart is already, there is hyperdynamic circulation. There is lot of fluid in the body. Blood is very less. There is lot of pressure on the heart. So heart is unable to pump. Number one. Number two, it is renal failure. In renal failure, because of any cause, there is renal failure. Definitely the patient ultimately lands in cardiac failure. That is another thing. Number one, severe MI. When the patient has got severe myocardial infarction, severe heart attacks. Severe heart attack also, the ultimate result will be heart failure. Severe heart attack, the patient can have heart failure, cardiac failure, severe heart attack. That is one. Diabetes, hypertension. See, diabetes, chronic diabetes, diabetes can cause cardiac failure. I told you it is diabetic cardiomyopathy. Diabetes directly affects the heart, and ultimately the heart, they say that heart enlargement, etc. You must have seen it. So cardiomyopathy because of diabetes can lead to heart failure. And one more thing is hypertension. Hypertensive cardiomyopathy. When the patient is having high hypertension for a long time, the patient can go for hypertensive cardiomyopathy, ultimately lands in heart failure. These are all the conditions. And one more thing is, see, in this type of heart failure, there is an important factor, rheumatic valvular heart disease. Valvular heart disease, because there are 4 valves in the heart. I will tell you, there are 4 valves in the heart which are functioning inside the heart. For the blood to pump, the heart needs therefore blood valves, these 4 valves. And one of the valves or 2 of the valves can get damaged because of one rheumatic heart disease. Rheumatic heart disease. Usually in childhood, this rheumatic fever comes. Acute rheumatic fever. Acute rheumatic fever in childhood can cause carditis. I will definitely try to make a topic on acute rheumatic fever. Acute rheumatic fever in childhood can slowly damage the heart, and particularly the valves in the heart. What are the valves in the heart? Number one, this is the heart. When you cut the heart, this is inside of the heart. This is the heart. There are four valves. One valve here. There are four chambers in the heart, upper two, lower two. So this is mitral valve, this is tricuspid valve, this is aortic valve, and this is pulmonary valve. What is this? So mitral valve is upper left part of the heart. When the blood is pumped downwards into lower, this mitral valve will act. It is only unilateral, one side only. Once the blood comes down, this closes. This mitral valve closes. So it is unilateral. And from this, the blood is pumped into the aorta, the major vessel which supplies whole body of the patient. This is called aorta. This particular tube is called aorta, which supplies body. The heart pumps, the aorta supplies. So there is a valve here called aortic valve from left to lower heart, the lower part of the heart that comes. Next here, right side of the heart, right upper part of the heart to lower part of the heart, there is one valve called tricuspid valve. And from right lower valve, from right lower part of the heart, this part, pulmonary artery, the blood which goes to pulmonary lungs, the blood supply, the tube which goes to lungs is called pulmonary artery. This particular vessel is called pulmonary vessel, and it has got a valve called pulmonary valve. So tricuspid valve, mitral valve, tricuspid valve, aortic valve. This one is pulmonary valve. Four valves. So any valve can get damaged. Any valve can get damaged. And once it is damaged, there is reverse flow. Till that time, won't be reverse flow. This slowly causes enlargement of the heart, and ultimately the patient lands in heart failure. So the treatment is, you have to change the valve. You have to put a new valve. That is by open heart surgery. There are multiple methods for it. Okay, let's go. So lastly, the important thing is, all these are because heart is failing to pump. All these problems are because heart is failing to pump. But the other condition is constrictive pericarditis or cardiac tamponade. Constrictive pericarditis, actually what is this? This is heart. There is one layer around the heart called pericardium. This is heart. There is a layer called pericardium. There is a layer. So sometimes what happens is, this layer gets infected and this layer becomes very thick. Pericardium becomes very thick. It is called constrictive pericarditis. That is, the layer around the heart is so thick that it is not allowing the heart to relax. It doesn't allow the heart to relax. So where is the question of pumping? That one. And in injuries, suppose there is a chest injury, there can be cardiac tamponade. What is this cardiac tamponade? So between the heart and the pericardium, that outer covering, there is blood, full of blood. This is full of blood, this area. Between the heart and the outer layer, there is full of blood, which compresses the heart.